Well, I'm joined today by Shirley Briarly, who's a member of the Bradford Safeguarding Childrens Board. She's a consultant in public health, and she also chairs the Child Death Overview Panel on behalf of the board. So, Shirley, let's talk about what is the panel? What is the Child Death Overview Panel?
Well, the Child Death Overview Panel is a statutory panel that every district in the whole country has. And the remit is really to look at exactly why children die in your district, to look for any potentially modifiable causes that you might identify so that you can reduce risks for children in the future. So obviously it's really important for us in Bradford that we understand why children die.
And who sits on this panel?
Well, there's a wide range of people on the panel, everyone from paediatricians locally to the police, to education, we have social care and the NHS there. And on our panel we also have a chaplain who on our panel. So we have a wide range of people. So when we have discussions, then we can have a wide-ranging debate and make sure we're looking at it from all angles. And the other thing we do is if we've got a particular area we want to cover, we'll invite the expert in that area.
All right. So, and this has been established for some time, hasn't it?
It has. It's been since 2008.
Yeah. In Bradford, what would be the number of children every year that you have to consider?
Well, there's about 140,000 children under 18, and we have around 70 to 80 deaths a year. And of course, every one of those is a tragedy. The good news is that our number of deaths is reducing. So our infant mortality rates and child mortality rates are reducing and have been reducing significantly over the last few years. But they still remain high, and obviously we're working on reducing them further.
Mm. So, we can all imagine the tragedies of children who die, but are there particular groupings in terms of more children at a certain age than others?
Most deaths in Bradford, as in other places, occur in the under 1-year-olds. So probably somewhere between 60 and 70% in under 1-year-olds. So we also have a big focus on reducing infant deaths. It's something called the Every Baby Matters programme, which I'll talk about a bit later on. But clearly we look at causes for the older children too, because that's important.
Let's imagine that one of the cases is a particularly significant, they're all significant, but one's a particularly troubling case, for example. How long would it take your panel to consider that normally? Would you be several meetings? Would a case move over?
Each case will be different. If it's straightforward and really clear what's happened, then obviously that might be one part of one meeting. But if it's a complex case and we want more information, then we'll delay and we'll bring the details about that child back to another meeting, because it's really important we understand exactly what happened, that we've got all the right information, because ultimately what we're interested is there anything we can do and recommend for organisations to do in the future to reduce the risk of that happening again. So it will entirely depend on each individual.
Which is a crucial part of the panel. It's not.
Yeah.
It's not just a sort of a statistical panel, is it? It's a learning panel.
Yes, yeah, and that's really important. And it's really important we link in with all the key work that's happening in the district. So we do, as you can imagine, have a small number, but a persistent number of children who are killed on the roads, for example. So we will link really closely with the senior leads for road safety in the district to look at the exact reasons why these children have died and look at ways of reducing the risk of the future.
Now, the government recently published some kind of consultations to do with safeguarding boards generally, but they did also mention the child death overview panels. Have you got a view on what the recommendations have been? There was talk about sort of maybe regionalising them rather than making them so local. I can't imagine there's not pros and cons to that. Now,
Yeah.
do you want to sort of say a little how you think on that?
Yeah, I think we're aware of a number of child health review panels that have joined together when the population size is quite small, and that kind of makes sense. But I think what we think for Bradford, population is about 500,000 total of the population, and we've got, as I say, about 140,000 children and young people, and we feel that's probably about our panel for the district seems to work well. So at the moment we're hoping that format will stay, but we'll see what comes out nationally.
Yeah. I mean, my understanding of it is that there's about 29-30% of that child population of that population essentially is under 18 of Bradford, generally speaking, and growing, I'm told. And in fact, some people even say Bradford's going to be the biggest area of children within the whole of the north of England in the not too distant future, which of course makes more work for people like yourselves and people like this panel, because statistics will follow that through. So, I mean, really what you're saying is you think Bradford's the right size for what it's got already?
Yes, I do. And as I say, we'll wait for the clarification nationally, but we think for the size of population, it's right that we should operate on a Bradford district level. Okay.
Thanks for that. Now, we're going to move on. Because you mentioned quite rightly in there the learning experiences that come from the information, the data, the conversation and so on that comes through that panel, but also as a consultant, as you are in public health yourself, you pick up all sorts of other initiatives and so forth. And one of them, I mean, I love this one, Every Baby Matters. Now, do you want to say a little bit about its origins?
Yeah, I will. I mean, Every Baby Matters approach came out of the Infant Mortality Commission. So those people that have been working in Bradford for a long time, our infant mortality rates were extremely high in between around 2004. And it led to a formal commission over a couple of years, and there's a report that was published at that time with 10 areas of recommendations. And really the Every Baby Matters work came out of that, and since 2006 that's been high profile in Bradford, and the work is across a wide range of different areas. So it can be anything from housing to nutrition in pregnancy and in the early years of a child's life, to making sure that pregnant women can access antenatal care early on, to supporting women to stop smoking in pregnancy, or for families to have awareness around genetic inheritance. So they're just a few examples. There's some, a wide range of different things that we work on. We work across these 10 recommendation areas. And I also chair that group too, but it's really the key work of all our partners. So whether within the NHS, within the council, within voluntary community sector organisations. And for example, we have a leaflet which is called Every Baby Matters leaflet that's available on Bradford Council website, which goes through all the things you can do, particularly with a focus on that maternal child health for young children, and what everyone can do, whether you're a pregnant mum or you're supporting a family, or you're a grandma or you're a dad, what you can do to improve the health of your baby and your child.
10 years that's been going. So I mean, and I know for outside this interview how positive you view that, how important you see that. I mean, recent initiatives, current things you'd like to see developed,
Yeah, I mean, lots of exciting things have happened. I mean, one of the things that has quietly been going on in the background, but I think it's very significant, is the fact that over 90% of women now access antenatal care before 13 weeks. Now, that was not the case 5 years ago. So there's a lot of hard work gone on around the district by our midwives and by our partners to really enable women to book early in their pregnancy. And of course, as soon as a woman's booked into antenatal care, then she can access all the support. Or if there's a problem, it can be identified early. So something like that is really important. And we've done a lot of work around supporting women to give up smoking. We've made some strides in that department, but we want to make more, and we've recently funded some additional work within our midwifery services to support women to do that, because it makes such a difference to outcomes for babies, as to whether, and we know for some women that's really hard, so they need specialist support.
Well, a couple of things. So many things are occurring to me here. We live in a wonderful, culturally rich city here in Bradford with 90 languages spoken. And obviously, every culture has got pregnant women and women with young children. I mean, has that proved a real problem in getting messages to every cultural group in Bradford? Or after 10 years, are you fairly clear that you're reaching most people?
I think we've changed the kind of work and changed the focus of what we need to do. And part of that is understanding the needs of our both of our pregnant women in the district, and what are the important things for them, and what's the best way of getting messages across, and how to help people understand what are the key issues for them. So for some groups, for example, the issues might be about smoking. For others, it might be around vitamin D deficiency, for example, in the South Asian population. And we've done a lot of work around that, around the way we've designed our leaflets and DVDs and general awareness. So, and another thing we've done is we've funded Healthy Start vitamins, which include vitamin D for all pregnant women. Okay. And for babies up to 6 months, and babies at risk after that. So that's been a policy which is particular to Bradford, because we understand what the particular issues are in Bradford, and we've met that need after consultation together with parents and with our key professionals that work in that area. So the thing about the Every Baby Matters work is it's ongoing. You don't solve problems in 3 months, 6 months, 12 months. You solve problems by being really clear about what you need to do and keeping your vision really clear and keeping on with that work and working with our health visitors, with our midwives, with their voluntary community sector, and using all the evidence that we know of things that work to inform what we do. So we've done lots of really close work with Better Start Bradford, which is our big lottery funded programme in 3 wards in Bradford.
Could you say just a little bit about that? Because people would know a bit about Better Start Bradford, but it is quite a significant initiative as well in complementing all the things you've said. It is.
So there's lots of district-wide work that's been going on for many years, and lots of improvements across all our services in lots of different kinds. But obviously, as a district, we managed to be successful in the bid to, and Bradford Trident lead the Better Start Bradford programme, but that's focused on pregnant women and children 0 to 3. So one of the things we're doing is all the things that occur within that programme are, we're working really closely with the Better Start Bradford team, so that we learn from what they're doing, they learn from what we're doing. Anything new that needs to be different, we make sure we do our best to implement that at a district-wide level, and it's an ongoing programme, so they're trying out new things, seeing if they work or don't work, and we're using that to plan our services right across the district.
And they track a lot of children as they grow, don't they?
They will be doing, yes. They've got a cohort of pregnant women and babies that they will be tracking over time. So we'll get some really good research evidence out of that. So that's a real asset for the district.
I mean, I have heard so many positive stories about that. Let me try and just tie together a few things that you've said, because you're a significant member of the Safeguarding Children Board, as well as all the different hats you've talked about already. And we all know, for example, the risk to children, and increasingly the public are more aware of this from conception to age 2, for example. And when you have issues such as we have in every part of the land, such as the domestic abuse and substance misuse, mental health issues in adults and so forth, the impact on children from both in the womb and up to age of 2 is hugely significant. And I know that you've talked and we've talked in the board about this as well, but Do you feel that emphasis on Every Baby Matters and all the Better Start initiatives and so forth really can sort of help get to some of the people who are most vulnerable?
Well, I think it's, yeah, I mean, that's part of what the whole programme is about. I mean, ultimately, there are some key people who have contact with families in, particularly midwives, GPs, health visitors and children's centre staff and other early years staff. And really, it's about making sure our staff have got the right training and support so they can support families and identify early on when there's a problem. So if there is issues around domestic abuse or issues around substance misuse, that those families are given that support, given that opportunity to improve things or get to a safe place or whatever's needed for that family. What's important about that is our professionals out there can spot when some early on, and that's absolute key role, as I say, for our midwives and health visitors. And we work incredibly closely with the key leads within those services, and with our children's centres and other early years staff, because they're the frontline staff out there working with families.
Members of the community too, we always try and encourage them, don't we, to kind of not be backward about coming forward.
Yeah, absolutely.
I mean, neighbours, friends, extended family, etc. It's not just necessarily the kind of the people who see children, the midwives, then the health visitors and so forth, and then the GPs and so on. But I mean, the community, if you like. Now, you mentioned earlier on some leaflets, you mentioned earlier on advice, you mentioned on where would people access these things?
Well, they can, if people are interested in knowing a little bit more about the Every Baby Matters, if you just put Every Baby Matters Bradford Council into, if you search for that, that'll come up. And we have got a leaflet there that will take you through all the key messages that we give for families. So, have a look at that. That's really worth looking at, and a bit more about Every Baby Matters and the work and the things that we do in a whole variety of different ways. So that's available online now. And if people are interested in knowing a little bit more about the Child Death Overview Panel, that is a report we publish every year. The 2014-15 is already on the Bradford Children's Safeguarding website, but we will be updating that.
That will be updated soon.
Yeah, it will be published very shortly in September, early October, to coincide with Safeguarding Week. So there's an opportunity there to have a look. And if you do have any particular questions about your own children, I suggest have a chat perhaps with your midwife or health visitor or GP if you've got particular queries.
Okay, now we've talked about various things here, whether it's the Child Death Overview Panel, the kind of Every Baby Matters and so forth, Born in Bradford too, we mentioned and touched on. But I mean, how are any of these issues going to be showcased, if you like, or highlighted or talked about during Safeguarding Week, which incidentally is the 17th to the 21st of October this year in Bradford? What have we got coming up?
Okay, so a number of different things. We've got the main thing we've got for Safeguarding Week is that we're offering 2 sessions for staff to really understand why children die in Bradford. We've found these really successful in the past. People found them really interesting, and they're quite interactive, and they enable them both to know about the work that we do for the Child Death Overview Panel, but also understand why children die and what their role is in trying to reduce the risks of child deaths in the future. So we're actually running 2 sessions this time because it was so popular. And the other thing we will be doing is we're starting up a newsletter which will go out to everybody and will be available on the Safeguarding website, children's website as well, because we think it's quite important that we just have a regular newsletter just to keep people informed about the work we do.
So the menu of events is available on the website.
Yes.
I guess too, people can also ask at the City Council kind of information sort of sites about Safeguarding Week coming up and have a look at the programme for the week as well and pick up some of the things that you've said if they're particularly interested.
Absolutely, yes.
I mean, it seems that you've got such an amount of work on, but you still seem very enthusiastic.
Well, it's very satisfying work, because when you see improvements in services and you see it's making a difference for children, that's what keeps you going. And it's the work of everybody, really. This is the work, it's the families and what they can do. Obviously, that's the most important thing. And really, it's our job is to support families to do the best they can for their children, but also supporting our staff to make sure they've got the right training and the right support to provide the right kind of services that the families need. So it's a whole host of work with everybody working together. But one thing I think we're clear about is that we've agreed how we're going to do that, and that makes the difference.
Shirley Briarly, thank you very much.
Thank you.